Just to give you an idea of some other sounds that occur at these levels. So the ticking of a clock, you can see in the top right corner there. If it's in the top right corner, that means it's very high in pitch, very high frequency, but it's a very soft sound because it's not very far down the graph. So that's a very soft, high frequency sound. Birds chirping is also very high frequency. Something like yard equipment or an airplane, those are very loud, so that's why those are at the very bottom of the graph. So louder sounds at the bottom, softer sounds at the top. So when we're testing your hearing, we're actually marking on that graph how you hear with both ears. So the red circles represent your right ear. So we would test your right ear first, and then we would test your left ear. And the left ear is the blue X's that you see. So this is a completed test for someone who had normal hearing. So across all of those frequencies, when we tested at different levels of loudness, they heard normally. We consider a normal hearing test anything above 20 decibels. So anything from about 0 to 20 is considered normal hearing. So that's a good test. That's what you want your hearing to look like. You want it to be nice and flat across the top of that graph. This shows someone that has a high frequency hearing loss. We know it's high frequency because in the low frequencies, 250 and 500, they hear normally, but they slope off in those higher frequencies. So now that grayed out area that you see there is this person's hearing loss. So they hear those vowel and consonant sounds very well, or I'm sorry, they hear the vowel sounds very well. The consonants they do not hear as clearly. So this may be someone that says, I can hear you talking just fine, but it's just not clear enough. I can't hear some of the S and SH sounds that you say. I maybe am confusing some of the words that you're saying with another word that sounds kind of similar to it. That might be something that this person would experience. It's not so much an issue with loudness of sound, but clarity is where this person is really struggling. We classify hearing loss in different ways. So if someone has normal hearing, that's at the top of the graph, and then a mild hearing loss would be kind of the beginning of a hearing loss. This is an example of moderate hearing loss. So anything kind of in that middle of the graph there would be considered a moderate hearing loss. This is considered a severe hearing loss. So remember, as we go down the graph, we're having to make sounds louder and louder for this patient. So keep in mind that the red circles and the blue X's is the softest sound that they can hear. So for this person, we had to make it pretty loud for them to even be able to hear the softest sound, which means that they're missing a lot of those vowel and consonant sounds. They really, if someone's speaking to them, they really need to raise their voice quite a bit for this person to even hear them at all. Whoops. So when a hearing loss is present, and when it's a sensorineural kind of hearing loss, like we talked about earlier, if there's no corrective procedure that can be done for this hearing loss, as an audiologist, we would recommend a hearing aid or a hearing instrument. This is what one type of hearing aid looks like, but hearing aids can come in many different styles. These are all the styles of hearing aids that we have at Widex. You may have heard the terms behind the ear instruments before, or you might have heard the term completely in the canal or in the ear hearing aid. Those are all the different styles that are available. We have some that can go behind your ear, kind of sit on top of your ear and direct sound into the ear canal. Those would be kind of the top instruments there. And then the beige colored instruments in the front are more custom instruments that would fit in your ear canal. So how do you know which one's right for you? That's a discussion that you would have with your audiologist. If it's a cosmetic concern that you have, then there are several different options. Sometimes it depends on the severity of the hearing loss, whether or not you're a candidate for some of these other styles. So many different styles available, lots of choices, lots of color options as well. I know that sounds kind of funny, but if you want something to be very discreet, we can match with hair color, we can match with skin color. So there are a lot of different options when it comes to choosing a cosmetic hearing device. Hearing aid components. Every hearing aid, so this is just one of our options, but every hearing aid has a set of microphones. It has a receiver, so that's where the sound is entering into the person's ear canal. And it has a battery, so hearing aids take batteries. And inside that instrument is an amplifying circuit. Think of it as a computer chip. So that's what the amplifying circuit looks like. So now we're going to talk about how hearing aids can differ, because all hearing aids have these components: microphones, receivers, batteries. But the amplifying circuit is what really makes one hearing aid different from the next. And that's what I want to kind of, I guess, clear up today, that some of these advertisements that you see in the paper, or something on the shopping network that lists a hearing aid for $100 and says this hearing aid is going to sound great for you. Well, why is it so cheap? Why is it so cheap compared to some other hearing aids that might be out there? The amplifying circuit is the reason why. So not every hearing aid is created equal. If you've ever heard a really bad sound system, if you went to a presentation like this, or maybe at church, something with the speakers wasn't right and you heard some crackling or you heard an echo type of sound quality, the amplifying circuit is what determines how good the sound quality is when you're wearing a hearing instrument. And if we want you to hear very well, if we're trying to correct a hearing loss for you, we need an amplifying circuit that's very sophisticated. We need something that's going to reproduce sound for you so that you can hear all the sounds that you're missing and you can hear as close to normal as possible. So this is what digital hearing aids are doing. Pretty much all hearing aids at this point are digital. Digital hearing aids will take a sound. So this is someone speaking, and that's kind of a sound wave up at the top there. It will take that sound and it converts it into a digital signal. That digital signal, once it's converted, this is happening now in that amplifying circuit. There's a sound processor that's taking that sound and determining how it needs to change the sound for you to hear it better. How are we going to amplify that sound for this specific person so that they can hear it better? So a lot goes on in this step. It's actually very sophisticated technology to take a sound, reproduce it, and amplify it for that specific person's needs. So every hearing aid is doing something different because everybody's hearing loss is different. So that sound processor will process the sound, it will convert it back to an analog signal where it passes out the receiver or the speaker of the instrument and into the person's ear canal. So a lot goes on in those middle stages there, and this is where hearing aids can really differ from each other as far as how well this happens. Advantages of digital hearing aids. Automatic volume adjustment. So if you have ever worn a hearing aid in the past, or you knew someone years ago that wore a hearing aid that didn't really perform very well for them, first of all, it may not have been a digital hearing aid, and it may not have been doing some of these things for them that a digital hearing aid should do. Automatic volume adjustments, meaning soft sounds like whispers or people speaking at a distance, we want to make those audible. We don't want to make them loud, we want to make them audible because we want it to still sound soft to you. Average speech should be comfortable and loud sounds should be loud but tolerable. That's how a normal person hears, a normal hearing person hears, so we want you to hear as close to normal as possible as well. So that's what a digital hearing aid should do for you. It should allow great precision in fitting that hearing aid for you. So when you visit the office of that hearing healthcare professional, Dr. Combs, when you visit with her, she should be able to take that instrument and modify it in many different ways so that it sounds better to you if you have any issues. Reproduction of sound, I mentioned that, taking that sound and reproducing it. That's very difficult for a hearing aid to do, to really reproduce sound accurately. So that's why some of those amplifying circuits can really differ from each other. We want it to be clear, clean, and crisp sound quality. So going back to some of those bad sound systems that you may have heard in the past, that's not how your hearing aid should sound. Your hearing aid should sound clear, clean, and crisp. Important facts about hearing aids: they can improve your quality of life. They've done lots of studies on how hearing aids can help those with a hearing loss. The more you know about them, the better decision you can make. So if you or someone you know needs a hearing aid, but you've been hesitant to make that decision, please visit with Dr. Combs and talk to her about your options, because the more you know about it, the better the decision is that you would make, and the happier that you would be with the instrument. As audiologists, we don't want you to be unhappy with your hearing aid. We know it's an investment. We know it's not cheap. We want you to be happy with that instrument. You don't have to be self-conscious about wearing hearing aids. Keep in mind that people of all ages wear hearing aids. Small children wear hearing aids. So you don't have to be self-conscious about it. They will help you hear better in a variety of listening situations. So whether it's, if you have specific needs, you want to hear better at church, you want to hear better at restaurants, hearing aids will help you hear better in all of those environments. So whether you just want to hear overall better or you have specific environments that you're struggling in, hearing aids will help you with that. They can improve your understanding ability and moderate amounts of background noise. So hearing aids in the past have perhaps not been sophisticated enough to handle things like loud restaurants. But when we talk a little bit about the Widex technology, you'll see that it is capable of helping you hear better, whether you're in quiet or noisy places, like restaurants, or if you like to go to symphonies, you get together with friends and everybody's talking and it's very loud, the hearing aids should help you there as well. So who is Widex? Widex is the 6th largest hearing aid manufacturer in the world. We're a worldwide company. It's privately owned and managed, so that's something to keep in mind. It's a family-run company. The same people that started the company in 1956 are still managing the company. So it's actually a really nice company to work for. I very much enjoy working for Widex, and we do have a very close relationship to the global headquarters, which is in Denmark. So we speak with them very often about what's new with the technology, what's coming out, so that we can bring that technology here to the US to help all of our patients. The international headquarters I mentioned is in Denmark. We are a green company, so in 2010 they built this new factory or a new building in Denmark that uses geothermal technology. It combines renewable energy. It's really a green building, so no matter what you're thinking about, whether it's the heating and cooling or the water supply, everything is very green in this building. All of our packaging that we use to send out our technology to different countries is completely recyclable. So there's nothing that we're using that can harm the environment in any of that packaging. Just a little bit about Widex as a company. But what's really important to know about Widex is that we have something called true ISP technology. Remember the picture of the amplifying circuit, that computer chip? We call ours true ISP. That stands for integrated signal processing. True ISP is the latest and best advancement in digital hearing aids that there has been in many, many years. So I mentioned how some hearing aids in the past did not do a good enough job of helping people hear in background noise. So that's been our latest advancement with our technology, is really changing the way that people hear in background noise. So if you do wear hearing aids, or you know someone that wears hearing aids and they really struggle when they go to the restaurant or the movie theater or the symphony, this technology can help them. It is very different than anything else that's currently available. So when you see some of those advertisements in the newspaper, or you get a flyer in the mail, keep in mind that all hearing aids are different. All of them have a different circuit. They're all made differently, and ours is specifically designed to handle those higher levels of sound so that you can hear crisp and clean and clear in all the environments that you're in all the time. Dream is the instrument that's what we call the instrument that you could be fit with in the office. So the True ISP is the computer chip that's inside of it, but the product family, we call it Dream because we feel like people hear like a dream when they're wearing this type of technology. So what's inside the hearing aid is what makes the difference. So these are two identical looking hearing aids. but one has the true ISP chip in it, and the other one does not. These two hearing aids will sound very different to someone. So if you've had a bad experience with hearing aids in the past, or you know someone else that bought hearing aids and they ended up in their drawer and they never used them and it was a big waste of their money, just keep in mind every hearing aid is different. Perhaps if they had tried something else, they may have been more satisfied. If you have not tried Widex before, and if you have been unsatisfied in the past, keep in mind that every hearing aid is different. So it really is worth a try to try this dream technology because it may sound very different than anything that you've heard in the past. We have in our technology something called inter-ear communication. Going way back to the beginning of the presentation when we talked about binaural hearing, how we hear with two ears and how it's ideal to hear with two ears, our hearing aids actually communicate with each other. So they are hearing sound in the environment. They're communicating with each other 21 times per second. Think about that. In the blink of an eye, those hearing aids have exchanged information 21 times about what environment this person is in, how can we make sound better for this person so that they can hear the person sitting across from them at the restaurant. So that's one benefit of our technology, what we call inter-ear communication. It provides a world of natural sound because it's actually mimicking what a normal hearing system does. Remember that both ears are designed to hear well and they're designed to send that sound up to the brain. These hearing aids are actually mimicking what a normal hearing brain does. So it's really cool technology. The way that hearing aids are fit. The reason you need to see a hearing healthcare professional to be fit with hearing aids is because of this reason here, among others. But this is showing you that hearing aids can be fit very precisely for you. They should be fit very precisely for you. So we need to know what your hearing loss is by doing that audiogram, by doing the hearing test. But we're taking that information and plugging it into the software of the hearing aid. So we use a computer to fit these hearing aids, and we can fit them very precisely for you. And this is another benefit of our technology. Our Widex hearing aids can be fit more precisely for you based on your hearing aid, or based on your hearing loss, than other hearing aids. So that just kind of goes back to my argument that not every hearing aid is created equal. We have better capabilities here to fit it more exactly for how you hear specifically. Noise management. This is something that every hearing aid needs to have. So when you walk from a quiet environment to a noisy environment, that hearing aid needs to react. It needs to know how to handle the fact that there's a lot of noise in the background, but that's not what you want to hear. Most of the time, it's not what you want to hear. You usually, if you go to a restaurant, you go there to hear the people that you went with. You go there to, hear the person sitting across from you. We don't want you to be overwhelmed by all the background noise. So every hearing aid should have noise management. Our noise management is constantly analyzing sounds. It's a dynamic system. It's constantly changing based on what the hearing aids are picking up. Remember, the hearing aids are communicating with each other with that inter-ear communication to really pull out voices from all that background noise. And all of this is being done based on your specific hearing loss. So keep that in mind. Everything is individualized for you. We don't just put a hearing aid on a person and hope that it's going to work well for them. We tailor everything for your hearing loss and the size and shape of your ear so that everything sounds very accurate to you. We want to preserve speech understanding while minimizing background noise. We can't eliminate background noise. No hearing aid can do that. But we want to minimize the effect of the background noise so that you can hear voices clearly.